Psychosocial considerations for the patient. These include increased incidence of alcohol or drug abuse. These can be used as a coping mechanism for the patient, as well as the patient may be experiencing depression, anxiety, or thoughts of suicide. So we need to make sure that the safety is a big thing for the patient and that we provide for their safety. Next, this was discussed in the treatment portion of this PowerPoint presentation, but we need to give the patient effective coping strategies, such as like relaxation techniques, deep breathing, provide distraction in order to help them through increased times or increased anxiety, times when they have increased anxiety, as well as trying to reorient them back to reality after they've had a flashback. Speaking on that, we need to provide a calm environment because an environment which there's a loud bang or commotion or a lot of stress, these things can trigger a flashback in a patient with PTSD. So we need to supply a calm environment to reduce anxiety, reduce stress, so that the patient doesn't get angry, and then also doesn't have a flashback. Lastly, we need to make sure that they have support from the family, their friends, and then also group support, like I was discussing earlier in the treatments, group therapy, people that have gone through similar situations as them and are suffering from PTSD, and they can come up with effective coping strategies and feed off each other. Next is family, psychosocial considerations for the family. Caregiver burden is the first one. So a patient with PTSD may be difficult to care for. They may be extremely depressed. They may not want to take a shower or do anything around the house, help care for the children. So whoever, most likely the wife, will get stuck as the caregiver for the patient, and this can become extremely tiresome. The wife not only has the kids and herself, but now the husband to care for, or vice versa. The husband has the wife that is experiencing PTSD, and now they have an extra person to take care of. It can become exhausting, so we need to make sure that we find out who the caregiver is, and then speak with them and provide them ways to care for themselves and provide not only for their physical but their mental well-being as well. We need to supply the family with effective therapeutic communication techniques. We need to let them know what is therapeutic communication and what is non-therapeutic, and this can be extremely helpful in dealing with the patient in times when they have a good amount of stress, have an anxiety attack, having a flashback or something like that. We need to also take into account that the family may be living in a fearful environment. This patient could be having 10, 20 flashbacks a day, can become extremely anxious, and anxiety can lead to anger. So we need to talk with the family about the environment which they live in as well. Now, this can harbor negative feelings towards the patient from the family, and we need to educate the family about the disease process of which their loved one is suffering from, and give them the education that they need to know that this is an illness, and it's not necessarily their loved one's fault for acting the way they do. This can also lead to anger from the family towards the loved one or towards the patient, and we need to let them express that anger and get it out in a healthy way, and work through it. The family may also experience guilt, feeling that they're the cause of why the patient is having the behaviors they are. or they're not doing enough to help the patient. This can lead to health problems for the family members, increased amount of stress. They can suffer from anxiety and on their own. Dealing with the high amount of stress levels, we all know that can shrink the hippocampus and lead to their own mental illnesses within the family of just dealing with this patient with PTSD. So we need to make sure that the mental health and the physical health of the family is taken care of as well. And the same as the patient, we need to provide the family with support from other family members, their friends, and then maybe put them in touch with support groups